Welcome back to the Silence of Shame podcast. We are super excited to have you again. It's your girl Life. You know who it is. Today we have a very special friend, Dr. Jayne Morgan, in the building, coming to tell us just how your physical health and your mental health go hand in hand. Welcome to the studio, Dr. Jayne Morgan. Super excited to have you. Just give us a little bit about yourself and how you landed here on the Silence of Shame podcast.
And thank you, Life. Love being here today.
Awesome.
This is so good. So I am a cardiologist. My name is Dr. Jayne Morgan.
Okay.
I'm the Executive Director of Health and Community Education at Piedmont Healthcare, but I actually came to Piedmont years ago to lead their cardiovascular research program.
Awesome.
And then to expand into innovation. During COVID, I sort of transitioned as many people were redeployed to lead the COVID task force and do a lot of education and health literacy. And now that we're on this side of COVID, I've kind of just continued with that and expanded to other topics outside of COVID. Before that, I actually worked in industry, AbbVie, Solvay, in real R&D, research and development, and medical affairs and business development. And then before that, I actually was a bread and butter cardiologist seeing patients like everybody else.
I mean, when have you had time to do anything?
I know.
Right? Like, are you living for yourself,
Yes.
Dr. Morgan? Awesome.
Good point.
Awesome.
Trying.
So you work with individuals who have heart problems, who are going through, or you used to, and now you're doing more health literacy around it.
Right.
Tell us some of the things you are informing and educating people around your, not only your heart health, but how your heart health affects your mental health.
You know, absolutely. So I spend a lot of time in women's health,
Right.
in minority health, how algorithms and formulas that physicians like myself follow, because we're taught these formulas, how those formulas have race factors built in them that then triages people of color and especially Black patients to lower levels of care. Talk about stress.
Wow.
You know you're sick, but your
somebody's
doctor's telling you that you're not sick because all of your medical indicators are normal, but they're normal because a race factor built into the formula has artificially normalized.
Right.
And so
That level.
That's right.
Right.
And so then you go home, and as we know, no disease process pretty much gets better on its own. So you're actually getting worse at home. And so, you know, Black people oftentimes have to be so much sicker than whites before you can get the appropriate referrals and medications and interventions, because we follow formulas.
Data.
That have race factors built into them, of which we are unaware. The doctor is actually using these formulas to guide their information and their message to the patient without realizing that the formula that they're using for this patient is actually different for the one from another patient.
Yes.
And so all of that, I spent a lot of time in that. I spent a lot of time in the menopause area. And why menopause is not recognized as a risk factor for heart disease, and all the symptoms of perimenopause and menopause that women go through, and we end up being misdiagnosed with what? Depression. And we are anxiety, and we're prescribed anti-anxiety antidepressant medication
instead of hormones.
There we go.
There we go.
Why don't we actually address the issue?
And everybody knows what happens at that age. So, but
imagine all of that stress. All of that is so stressful to just live in America and navigate as a minority, as a Black, as a woman.
Right.
Very, very difficult to navigate our medical system. It is a challenge. So I spent a lot of time in the area trying to educate people.
I was just
giving them the tools to understand really what their health is. No, you're not depressed.
Yeah.
No, you're not anxious.
No,
your estrogen
you're actually
levels
having
are dropping.
problems. Right. I think I'm me and Perry are now sleeping in the bed together because she's knocking on my door and I'm not trying to let her in. She's not a woman that won't come in the door, right? So tell us just what you mentioned and how algorithms and data inform medicine, and you being a Black woman and being in medicine. Tell us how that stress of knowing that we're not being heard can exacerbate whatever is going on in our bodies.
And I am walking on both sides, right? So I'm a physician. I'm walking on this side of it with medicine, but I also can see what's happening with the patients. And oftentimes it's invisible to others. And that's the other, piece. Problem, the other piece, that you're walking and you are seeing something that is invisible to everyone else, and trying to find the power to step into your power to raise the specter of information.
Right.
Especially when the horse has already left the barn.
Yeah.
It's all once the horse is out of the barn, it's
hard to pull it back in. Yes.
And so that's where we are. And so I spent a lot of time in that education, but we've got formulas for cesarean sections. It's called VBAC, vaginal birth after cesarean section.
Wow.
And it's a formula that we use to determine whether or not a woman who's already had a cesarean section
has to have another
one with a subsequent pregnancy. And there's a race factor in there.
There is.
Yeah. Whether you're Black or Hispanic, answer is just yes or no. And if you answer yes to that, if you are a member of one of those races, then you automatically are guided to a different value that then pushes you into the category of needing to have a repeat cesarean section. And let me be clear, cesarean section is surgery. So here's what we're saying in medicine. You need to have more surgery. And so when we talk about maternal mortality, all of this is a piece of it.
It all plays a part.
Repeat surgeries, recovery time, surgical complications. Black women have more cesarean sections, more hysterectomies, more of, let's just say,
they're ready. They're ready to cut on us at any given moment.
And all of that goes into health, even vascular complications, not just of women, of men as well. I'm shifting now from maternal mortality. But we have more amputations as opposed to limb-saving procedures. We're more likely to have our limbs removed.
Because of that algorithm.
Not only because of the algorithm, but also because of social implications and social bias, and who's offered these life-saving interventions and who isn't, who's considered a good candidate for them.
That's the thing,
term,
like the good candidate. I'm dying.
That's right.
So why am I not a candidate?
So these are all these social factors.
Yes.
So it is an uphill
You're giving some
climb.
insights.
It is something to be on the inside of it as well.
It's such a difference. It's such a difference because when you were performing surgery or performing procedures, you saw the procedure and you saw the person.
That's right.
But now that you're in health literacy, how much more do you see the person before you see the surgery now? And what is that like in you educating other cardiologists or other doctors around seeing the person before you see the problem?
Right. I always see the person. And I think many doctors see the person, but it's also cultural congruence.
Thank you.
You have implicit bias to your own set that you recognize.
Yeah.
And so that's what you see.
Are you taught that?
Do you see with your eyes, or do you see with your mind
or your heart?
And things that are already taught to you? And so most doctors will say, no, I'm not biased. But then when you really dig down into it, you see that they are seeing two patients who essentially are identical, but seeing them differently without realizing it, and their medical advice is a little bit different. And the interaction that a patient has with their physician can also drive
what's the outcome of
the outcome. Yes. That relationship can drive the outcome, whether they feel heard, whether they were comfortable asking the questions that they needed to ask, such that they could actually go home and do what they needed to do. Oftentimes, women and minorities leave the doctor's office with more questions than they entered with.
That's how it happens, right? Like you're not, and because
you go home more confused. I didn't get that question, and I didn't answer. I didn't ask that.
I didn't know to ask that. I didn't feel empowered. I didn't feel like they knew me as a culture.
I felt embarrassed. I didn't want them to know that. I didn't know if they would understand.
Yes, that implicit bias. Yes,
that's right.
All of those pieces.
I could tell by the way he was talking. He didn't really know.
He didn't know or care to know.
But thought he knew everything. Yeah. And was talking over my head. I didn't want to seem stupid. Yeah. I didn't know. Instead of saying,
I don't know.
No question. Like my mom. I don't really understand the Latin.
No question is a dumb question, especially if you don't know the jargon and lingo that they're using.
But if you already are made to feel inferior. Or less than,
you're not going to feel empowered to do that.
We're doing you a favor to be here. I'm in a rush.
Yeah.
I need to see and
all
do
these
things that are more
yeah.
important.
You're holding me up. You're holding me up.
Oh, you didn't take your medicines? Oh, just somebody else who doesn't want to follow my advice, as opposed to sitting down to say, why didn't you take it?
What's going on? Can you afford the medicine? Or do you understand what the medicine is doing?
Maybe you just didn't get the questions answered.
Maybe I'm not taking something I don't know anything about.
I didn't understand. There you go.
You see many ways of how we react to doctors as well, because it's on the patient side as well.
Sure.
What is the difference in serving different cultures, and what do you need to know as a cardiologist, as a doctor, when dealing with different cultures? Because how you talk and how you treat them will change how they will respond to what you're asking them to do, but also may trigger moments in their mental health that won't allow them to hear you of what you're trying to do. How do you navigate those different cultures?
Let's talk about that. Let's talk about something called the weathering effect. The weathering effect is the advancing age, the biologic age, meaning how old your body really is in comparison to how old you are from your birth date.
Got it.
And Black women's biologic age is more advanced than your chronologic age. That's called the weathering effect. The reason for that is the chronic, unrelenting need to be in fight or flight, in navigating a system that is unjust and biased, in having to chronically step up, to always be on guard, to not be able to be ourselves, to know that ourselves are not welcomed. And here's the thing, mothers of Black sons report even a greater degree of stress and therefore weathering than Black mothers who do not have Black sons, predicated on having to teach your sons
how to deal with this world,
how to navigate America, knowing that they are targets here in the United States. That is called the weathering effect. And when they say Black don't crack, not on the outside, but on the inside, we are older than our stated age. And if you need any proof of that, we even go into menopause, which is a measure of age advancement a year and a half earlier than white women because of this weathering effect. And if you need even more proof, biologic proof, on our chromosomes, on the ends of our chromosomes are caps that are called telomeres. The length of these telomeres really correlates with age and youth. And Black women have shorter and shorter and shorter telomeres as compared to other groups as we age, again, demonstrating that advanced age. So when you think about that, then when a woman comes to see the physician or cardiologist and she's stating this is her age, maybe we need to think
what's happening
that
inside.
the age is more advanced because of the chronic, and then predicate that on the type of testing, the type of, so we talk
Treatments
about now
you
increased
decided,
cancer rates. And we see that also in the Black community. Screening doesn't start oftentimes for cancers until 40 or 45 or 50. So we're having younger and younger people for whatever reason. There are a number of reasons. We can talk about it if we want to, for why cancer rates are increasing. But if we start to treat people based on their chronologic age, how society and stress is aging the person, then now we're catching more disease
way ahead of time.
Instead of their biological age. But it's not a recognition of that. It's called the weathering effect. As a mother of a Black son, of 3 Black sons, I'm not excluding myself. I am weathered.
I'm with you. I have a Black son myself. And
this is it.
Is that, so we consider that strong Black woman syndrome, or we're always in defense mode when we're talking about our children or ourselves or our families.
Right.
How do we shift that? How do you, with you being in health literacy, what are you informing and educating on us how to shift that?
That's right.
Is there a way to shift
chronic
this?
Code switching and everything that it requires to sort of be successful, or not even be successful, sometimes just to survive.
Just to thrive and survive,
in a society that often is gaslighting you. You're fine. You're very good where you are. You don't need to advance. This is not for you.
What do you need over here?
So, something that I think that I'm seeing more and more and more of, we, and this is just for everybody, not even just for Black women, but feeling angry and disappointed, and unhappy with interactions that you're having with people and how people are behaving and treating you. And really, we need to look at it as taking our power back, because really what we're saying is we're unhappy and disappointed in ourselves.
And you have the power to change,
allowing
them power
to take your power.
Yes.
And we've got to begin to understand that
it's
anxiety and stress that we are attributing to others is really our disappointment in ourselves in allowing that treatment.
That's big. That's a pivotal moment, is recognizing that we're doing it to ourselves.
Right.
And once we release I've got to show this because of them, or I got to do this because of them, instead of doing it for ourselves, then we start to change that chronological age within ourselves, right?
And we begin, we still are going to live.
I mean, we still have, I'm trying to figure that part out.
That's right. It has been difficult to overcome 400 years of slavery, mostly because we're so easily recognizable. They say, oh, well, why can't you, do X, Y, and Z? Other cultures have done it. Well,
other cultures are starting where we start.
Not only have they not started, part of it was we can't change our skin and we can't change our hair.
That's it.
We are easily recognizable. And so it makes, as a group, you more easily able to be puniated, and have punitive behavior. There are other cultures that can kind of,
fit in.
Box and weave, and they do bob and weave and do a lot of it. Not a lot of bobbing and weaving in the Black. It's like it is what it is.
Right. There she is over there. Right.
And you can't really hide it. And so, and here's the other thing.
Do we want to hide it?
Most of us are not trying to hide it.
Do we want to hide it? Do we want to hide it?
We love it. Yes. We're beautiful. We move forward. But the fact of the matter is we're also punished for it.
Yeah.
In society, and that's that weathering effect where we are, it's almost you're punished for being yourself, but also you have to survive and navigate. It's what it really is constant high effort coping. Gotcha. Is what it's called. High effort coping. Constant high effort coping leads to weathering effect that other races in general and other cultures don't have. They have to some degree, but everything with the Black race is always to the extreme because we're so easily identifiable.
This is good. And you are giving nuggets to the people. Yeah. And they don't realize that they didn't realize they were coming here to get a full-on cardiologist here to tell us how to stay healthy. So your heart is connected to your mind.
Right.
Your mind is connected to your heart. As a cardiologist, how are you trained in your field to take care of the heart, but not let go of the mind?
Yeah. So let's start with how should we untrain ourselves.
Oh, I just read a book. I'm learning to untrain myself, right?
Untrain everything that we've learned. But listen,
which is hard.
Yeah, we know now that a large component of heart disease is due to inflammation in the body, chronic inflammation in the body.
Okay.
Inflammation in the body is caused by a number of things. It's caused by chronic disease processes, including obesity, considered a disease process, diabetes, arthritis, liver disease, heart, chronic disease, including mental health and stress. That all causes chronic inflammation. So all these things cause chronic inflammation. And then what happens when your body's in a state of chronic inflammation? They also cause all of these other things. They make obesity worse. They make diabetes worse. They make heart disease. They increase your joint disease. And then those things flare up. And then what? So it's just this crazy
constant
cycle that keeps going, and it eventually leads to heart disease, but also cancers and other things.
Wow.
So we've got to begin to think about how food is medicine, how we consume food that has anti-inflammatory properties, and what foods have pro-inflammatory properties. And, just in general, at a high level, we're talking about more fruits and vegetables,
right,
and less processed meats and fried food, just at a high level.
Right.
If you just want the
big
quick and dirty.
Right. We'll bring her back to give us a full list.
And so if you can decrease the inflammation in your body, you decrease the risk factors for all of these things, including heart disease and including cancer.
Yes.
Mental health drives a lot of this chronic inflammation. And we know now that chronic inflammation increases those risk factors. And so mental health is incredibly important because it can keep the body in a chronic state of stress and inflammation that then drives
triggers all the
physical disease.
Yeah.
That sometimes won't be measured for another 20 years. Cancer takes a long time to grow. Heart disease takes a long time to develop. So if you don't get your mental health under control and try to actually manage it and address it and take the breaks that you need and the self-care that you need, you think that you're doing okay. We're back to this high effort coping.
Right.
This weathering effect. But the other side of the weathering effect is
the long term.
The long term. You end up with more heart disease, more cancer, more arthritis, more autoimmune diseases, more liver disease, more diabetes. It just goes on and on and on. More obesity. That's the weathering effect.
We're so used to doing that. Generations of
high effort coping. Generation after generation. The other way to describe that is surviving.
Yeah. We're always in survival mode.
Always in survival mode.
Knowing that we have more younger people. I had my brother-in-law's brother passed away of a heart attack at 52. And I'm 45. I'll be 45 in August. When I was younger, you thought of older people having heart attacks. You didn't think of my 50-year-old brother-in-law would have a heart attack.
Right.
How do we inform our teens, our young adults, individuals who are hearing this for the first time of how to change that cycle and how to shift what they're in and doing now and consuming now? What do we give the young people so that they have a chance of living past 60 and 70 years old?
Yeah, listen, we have our children, we raise them, we talk to them about the birds and bees, we talk to them about sex, we talk to them about protection, but we never talk to them about any other life transitions like menopause and perimenopause. Nothing's ever talked about. So the reason I bring that up is the number one killer of women in the United States of America is heart disease.
Wow.
It's not breast cancer.
Wow.
It's not lung cancer. It is heart disease. More women die of heart disease than any other disease process. And listen to this. I was running the COVID task force. Even at the height of COVID, we lost over 1 million people
to COVID. To heart disease?
To COVID. Even COVID, at the height of COVID, did not dethrone heart disease from the number one killer. And not only of women, but of men as well. That's how prevalent heart disease is in our society. But women in particular, I want to focus on, and Black women, because our risk of heart disease prior to menopause is only half that of a man. 50%. That's because we have the protective factors of estrogen in our body.
In place.
Estrogen not only protects our heart, it also what? Has anti-inflammatory properties. We're back to this inflammation.
I just read that.
Maybe I wrote it. I don't know. Maybe. I'm always writing these papers. But by the time we get to menopause, our risk of heart disease equals that of a man. And by the time we get in our 70s, it actually surpasses that.
In that short amount of time.
In that short amount of time. And all of the symptoms that we have of menopause, you can suddenly get an increase in your cholesterol and lipid panels within a year or two, elevated blood pressure, sleeplessness. We know that sleep duration is directly related to heart disease. Hot flashes, or as we call hot flushes, the duration and intensity of those symptoms of hot flushes are related to heart disease, and Black women tend to suffer them more intensely. And yet all of these are ignored. So even individually, there are risk factors for heart disease, but then during perimenopause, they're all happening at the same time. And we're prescribed antidepressants for them. Meanwhile, our heart disease risk is continuing to increase.
Because you're not even tapping into what the true problem
not
is.
Only
underlining issues are.
Talk about stress and mental health. Meanwhile, you're at home. You don't feel well. You're trying to work. You can have brain fog as well.
Yes.
You're struggling with your memory. All kinds of things. Deodorants don't work anymore.
And everything is falling apart.
Everything's falling apart. And they're telling you
you're depressed.
Imagine that. It's all in your head. There's actually a book called "It's All in Your Head." An excellent book to read. And it's not in your head. These are all true, and they're all risk factors. And cardiologists like myself still are not recognizing. This is what I talk about. Not only it's hard to teach when you have to first unlearn to then relearn. And listen, they did a survey, and only 22%, a survey of doctors, only 22% of primary care physicians even felt comfortable treating a woman with heart disease symptoms.
Wow.
And you can believe this, only 42% of cardiologists, that's actually our job, felt comfortable treating women with heart disease. And that makes sense when you think about it, because most cardiologists are men. So
they don't understand women.
Not only do they not understand women, a woman's symptoms of heart disease can be different.
Presented very different than a man.
Present very different. So there's another stress factor. You're not feeling well. You keep going to the doctor. They're telling you you're fine. You're going home. You're not feeling well. You're more and more stressed. And basically you're having a heart attack. And that is why a woman's first heart attack is more often fatal than the first heart attack of a man, because we use this term called atypical to characterize a woman's symptoms. And let's be clear, lexicon is important, the language that we use, because it can drive action.
Yeah.
And so if our symptoms are atypical, meaning we may feel run down, we may feel fatigued, we might have back pain, you may have jaw pain that actually might send you to the dentist. All of these vague, nonspecific symptoms that actually are symptoms of a heart disease that can be in a woman. And she sees a doctor, and the doctor gives you the proverbial pat on the back. There.
It's like
Here's
mental
an
health.
Antidepressant.
It's like mental health. They don't see it. It's not a physical ailment that they see.
You don't feel well, and there you are. Stress is getting bigger. Stress is getting greater. Back to that weathering effect. Back to more inflammation in your body.
Yeah,
and then you have a heart attack. Your first heart attack is fatal. And it was missed. And not only was it missed by the medical establishment, it was missed by you as well, because we don't teach these other symptoms of heart disease. We teach chest pain, shortness of breath, start to sweat,
it's left on the right side. You have take an aspirin, Bayer thing.
And it's not. And we call the woman's symptoms. When I say we, I'm talking about the medical establishment. I'm talking about us. I'm talking about me.
Yeah.
I'm
you
talking
and
about
your
how
colleagues,
we learn.
right?
They are called atypical symptoms. But here's the deal. Women are almost 52% of the population. We're more than half. So maybe we're the ones having the normal symptoms.
You might want to listen to something
maybe
that's going on.
Maybe it's the men who are having the atypical symptoms. So here's a great example of, who's driving medicine, who historically has driven medicine. So it's practiced and preached and taught from that lens.
Yeah.
And it's hard to undo that.
It's hard.
It's hard.
It's hard. They don't want us in charge, and they don't want us to be the reason
well,
why.
and you see it,
hard, yeah.
and you can work on it at an individual level if patients are lucky enough to find you and come to you. But how do you
on
fight
a massive
City
global
Hall?
right?
There we go.
How do we get to legislation?
There
and
we
change
go.
legislation.
Now, and
Because
we are working on that.
And
next week I will be in D.C. working on legislation.
Because it takes that much. It takes that much to make a difference. I know we're coming. We could be here all day.
We could be.
I love
this
it.
Is my thing.
But I want you to tell women, men, Black women, Black men, women and men in general, how to advocate for themselves when they're not being heard by their doctors.
Right. I have a really good friend. Her name is AJ Johnson. And, I'll give her a plug. You can follow her at the AJ Zone. But you know what? I was listening to what she calls one of her downloads. And I like the way she characterized it. So I'm going to say it today.
Okay.
She calls it the pinch. If you feel the pinch. So if for whatever reason you're in a situation that is uncomfortable for you, it may be comfortable for everybody else, but it's uncomfortable for you. And you're feeling that little pinch.
Yeah.
That is an indicator.
Get up and go.
That is an indicator that something isn't quite right, even though it may be disguised as love.
As the perfect.
It may be disguised as being helpful.
Yes.
It may be disguised as care. That little pinch is letting you know
something isn't right.
You're pinching your soul that there is something that is not okay with me and my boundaries that is not aligning. I'm not getting what I need. So pay attention to that. That is maybe a survival mechanism, and we are accustomed. We're back to high effort coping. We tolerate all the pinching because
we're taught
we are weathered.
Yes.
And we have to survive, but we need to maybe dial into that pinching and then step into our power.
Okay.
And stop allowing other people to have the power. If you need to change doctors, change doctors.
I was going to say that.
If you need to change doctors 2 times, change doctors 2 times.
How do you do that without, how do you change doctors? And I'm trying to say this in a nice way without pissing them off.
Yeah, there you go. And listen, it doesn't have to be antagonistic.
It has
every doctor, just like every person in your life, every doctor is not meant to be with you through your whole journey.
That's right.
Some people have served their time.
Exactly.
And let's just talk about menopause again. I'm back to one of my favorite topics.
I need to listen hard.
If you are seeing your doctor and you are in your late 30s and 40s and you're having all kinds of symptoms, you don't know what it is, you've got and crazy symptoms, itching in your ears, your body's itching, your taste buds are changing, you can't keep up with your memory, you're forgetting things. Everything is different.
Yeah.
And this is kind of these perimenopausal symptoms that you're talking with your physician. They're giving you kind of what I call the proverbial there.
Right.
There. Why don't you take a break?
Yeah.
Go on a vacation. Tahiti's a great place. Here's an antidepressant. We'll see you in 6 months. Listen, you can just say, thank you, Dr. Whoever.
Right.
We have had a great 20 years. But now I need something different, and I need to step into something else and find somebody who's menopause certified and sit down with that person. I'm hoping at some point cardiologists will all catch up with this and we'll begin to manage it. But every doctor doesn't serve you at every phase of your life, just like sometimes every person doesn't serve you in every phase of your life.
Everybody has a season and a reason, right?
Even I have people that are friends who probably should have been kicked to the curb a long time ago. Every time I see them, I'm getting
probably
pinched
and twisted like my grandma used to do me back in the day, and you just kept saying, "Oh, she's going to be fine."
That's right.
That's just who she is.
I'm trying to just deal with it.
She's the only friend. Dr. Jayne Morgan.
And we know.
Yes, we should have ran.
We don't feel empowered to do it. And what are we trying to do? Another thing, the way we sabotage ourselves is people pleasing. Which think about people pleasing. Another way to describe that is low self-esteem.
Yeah.
Giving your power away. Even I'm trying to learn that. So you can follow me. Hey, I pick up on all these from the AJ Zone as well. Not trying to plug her, but I also don't want to take credit for everything.
I love it.
We can all learn from everybody
and
move it forward. So,
well, tell them how they can learn more from you, Dr.
Hey, listen,
Jayne.
follow me. I'm on Instagram at Dr. Jayne Morgan, DrJayneMorgan. I've got a Y in there. I'm also on X and on LinkedIn, so feel free to follow me. I post all kinds of things. I actually do something on Wednesdays called the Stairwell Chronicles, where I sit on the stairs of my house, and in 60 seconds or less, I give you one little nugget about medicine and about your health that you can just take with you for the week. So if you go through my feed and look on Wednesdays, you see me sitting on the steps, tune in, 60 seconds. I'm just dropping a dime on you that day, and you can just move on with it. So feel free to follow me. And I only talk medicine, I only talk science. Every now and then I throw something else in, but it's science and medicine in an easy to understand and relatable format.
I love that.
Right.
You go follow her on Wednesdays for Stairwell Chronicles. Then you come over to Silent Shame and come to our Wellness Wednesdays.
We go.
And now we're covering our physical and mental health.
There we go.
Thank you so much.
You are very welcome.
Truly, truly appreciate this.
I love it.
I think our listeners will learn a lot from this episode. Probably going to bring you back on to talk about Perry and Minnie. We'll talk about them later because we could be here
talk
for
about a lot of things.
Right? But I don't think us as Black women get that information that we need.
We
so
don't.
I'm super excited to bring you back. Sure. Maybe around Women's Health Month or something, but super excited.
Listen, every day is Women's Health Month.
It is. Right. It is. If you're a woman and you need help, it's the day for it, right?
It is.
You guys, I told you I had a special treat. We're super excited to have had Dr. Jayne Morgan here to give us such a wealth of knowledge around your physical health is attached to your mental health. Always remember that. Come back and visit us. We'll have more great opportunities for you to gain tools, skills, and opportunities to better support your mental health. And don't forget to always text silence to 707070 if you would like to donate. But remember to take time, free your feels. It will save a life and silence the shame. You know what to do. Like, comment, share, and subscribe. We're on all platforms, and we'll see you next week. Have a great, great day.